COPD symptoms, treatment and prevention explained. WHO guidance for lung health. Hello everyone. A persistent cough or a feeling of shortness of breath when climbing stairs is sometimes mistaken as a sign of age or temporary fatigue. But in reality, it could be a cry for help from lungs that are gradually weakening. If these manifestations are not correctly recognized and intervened in time, they will progress, causing irreversible damage to the lungs. However, from a modern medical perspective, when we detect early and have proper management strategies, lung problems can be completely controlled stably. In today's video, we will deeply analyze chronic obstructive pulmonary disease based on the latest guidelines from the World Health Organization, helping you understand why listening to your body is of vital importance. Before going into the detailed content, please subscribe and turn on notifications for the MMM channel with the YouTube handle at MMM. YouTube want to continue accompanying us on the journey of healthcare throughout the human life cycle. And now, we begin the main content. Chronic obstructive pulmonary disease, commonly known by the medical term chronic obstructive pulmonary disease, is a chronic inflammatory lung condition that causes obstructed airflow from the lungs. To clearly understand this disease according to the standards of the World Health Organization and United States medicine, we need to analyze through the following key aspects. One is, we need to recognize the nature and typical symptoms of the disease so as not to be confused with common flu episodes. This disease usually includes two main conditions, chronic bronchitis and emphysema. Chronic bronchitis occurs when the bronchial tubes that carry air into the lungs become inflamed and secrete too much mucus, leading to a persistent cough with phlegm. Meanwhile, emphysema directly attacks the small air sacs at the end of the airways, destroying their structure and making gas exchange difficult. The first and most common symptom that patients often encounter is shortness of breath, which initially only appears during exertion but gradually will be present even at rest. Accompanying that are persistent coughs, often appearing more in the morning with a significant amount of phlegm that can be white, yellow, or green depending on the level of infection. Patients also frequently feel chest tightness or have a wheezing sound coming from the chest every time they breathe. These signs do not appear suddenly, but progress silently over many years, causing many people to only go for a checkup when lung function has significantly declined. 2 is, researching the causes and risk factors is the key step so that we can have effective prevention measures. According to reports from the World Health Organization, the leading cause, accounting for the majority of cases, is smoking or regular exposure to secondhand smoke. Toxic chemicals in tobacco directly destroy the cilia in the respiratory tract, losing the lung's ability to self-clean. Besides, indoor air pollution from cooking with biofuels such as wood or honeycomb coal is also a dangerous factor, especially in developing areas. Outdoor environmental pollution with fine dust and industrial emissions, along with exposure to chemicals or occupational dust at the workplace, such as coal mines or construction sites, also plays an important role in promoting the inflammatory process in the lungs. In a few cases, genetic factors related to the deficiency of a protein that protects the lungs can also be the cause, making a person suffer from the disease even if they do not smoke. 3 is, the diagnosis process to confirm the disease needs to be performed scientifically at specialized medical facilities according to international standards. The most important method currently is measuring respiratory function with a spirometer. This procedure requires the patient to blow into a tube connected to a machine to measure the amount of air the lungs can hold and the speed of the airflow when exhaling. Results from the spirometer will help doctors determine if the airways are narrowed and the severity of the obstruction. In addition, diagnostic imaging such as chest, X-rays, or thoracic computed tomography scans are also very necessary to rule out other diseases such as pulmonary tuberculosis or lung cancer. In necessary cases, doctors may request arterial blood gas tests to measure oxygen and carbon dioxide levels in the blood, thereby accurately assessing the gas exchange capacity of the lungs. Phlegm testing also helps determine if bacteria are present to provide the most appropriate treatment regimen. 4 is, modern treatment methods focus on relieving symptoms, preventing exacerbations, and improving mobility for the patient. Although chronic obstructive pulmonary disease cannot be completely cured, bronchodilators play a fundamental role in helping patients breathe easier by relaxing the muscles around the airways. Medications are usually used in inhaler form to act directly on the lungs and limit systemic side effects. For cases with severe inflammation, medications containing anti-inflammatory components will be prescribed in combination. Another important measure is oxygen therapy, which helps provide the necessary additional oxygen for people with low blood oxygen levels, thereby protecting the heart and other vital organs. Pulmonary rehabilitation is also a comprehensive treatment program, including exercise, nutritional counseling, and psychological education, helping patients optimize their remaining respiratory capacity. In the most serious situations, when internal medical measures are no longer effective, surgical interventions such as lung volume reduction surgery or lung transplant can be considered. 5 is, long-term prevention and control strategies play a decisive role in preventing the disease from progressing further. The World Health Organization emphasizes that quitting smoking is the most important action and brings the greatest benefit to lung health at any stage of the disease. Annual flu vaccinations and pneumonia vaccinations against pneumococcus are also very necessary to minimize the risk of dangerous acute exacerbations. Patients need to maintain a balanced, nutrient-rich diet to maintain the strength of the respiratory muscles, while drinking enough water to help thin the phlegm and make it easier to cough up. Keeping the living environment clean, staying away from irritants such as paint smells, strong perfumes, or smoke and dust also helps protect the airways from further irritation. In addition, practicing breathing exercises with the diaphragm and pursed lip breathing under the guidance of medical experts will help patients control shortness of breath better when doing housework or when walking. Absolute compliance with the doctor's treatment regimen and periodic follow-up visits are the golden keys to maintaining health stability. In summary, a deep understanding of chronic obstructive pulmonary disease according to international medical standards will help us have a correct and more proactive perspective in protecting the lungs of ourselves and our loved ones. The combination of medical treatment, lifestyle changes, and the environment is the only way to repel the negative impacts of this disease on human health. Finally, we need to deeply remember that respiratory health never collapses in a single day, but is the result of damage accumulated over many years. Every time we are subjective before a persistent cough, every time we are indifferent to the feeling of slight shortness of breath when moving lightly, and every time we delay a health screening, it is the time we unintentionally push the lungs into a dangerous situation. Leading medical organizations in the world all agree that early recognition and intervention of lung abnormalities is the most important foundation to protect respiratory capacity and quality of life. When humans correctly understand the signals the body sends out and act promptly, the burden of lung disease can be completely minimized. Proactive monitoring of respiratory health not only helps prevent disease progression but also contributes to maintaining a more active and sustainable life. If you find this content useful, please subscribe and turn on notifications for the MMM channel with the handle @MMM, YouTube in English, and the LQT channel with the handle @LQT, YouTube in Vietnamese. On these two platforms, we commit to continuing to share in-depth content on protecting the lungs, liver, kidneys, cardiovascular system, and common non-communicable diseases. Health does not come from luck, but is the result of correct understanding and choices made at the right time, in the right way. Thank you for following the entire content of this video today.